Días a todos y a todas. Mi nombre es Mónica Darer, trabajo en la oficina regional de UNICEF en el área de protección de la niñez. Y bueno, muchas gracias a todos por compartir este espacio esta mañana y especialmente por compartir la preocupación por la protección de los niños y niñas adolescentes en el contexto de COVID-19. Antes de empezar con la sesión, quisiéramos explicarles que hay interpretación, hay traducción que pueden utilizar. Hay un botón en el fondo de la pantalla que dice Interpretation. Y ahí ustedes pueden ver sobre ese botón el idioma en el cual Regional Office for Latin America and the Caribbean in Panama. Thank you very much for everybody for connecting and for your interest in hearing more about the child protection systems in the context of COVID. We are going to begin the session, but before we begin, we wanted to let you know that there's an interpretation button. We have translation services available, but you'll need to press on the interpretation button that's at the bottom of the screen, and there you'll have the choice of hearing the interventions in either Spanish or English. I will continue the introduction in Spanish for those of you who want to use the English translation. Also, to let you know that you can use the chat if you have any questions about the interpretation or if you have any comments. We will be monitoring the chat, so please feel free to write your comments in the chat. También decirles que tenemos el chat abierto y que pueden poner ahí cualquier pregunta que puedan tener o cualquier comentario a lo largo de la sesión. Bueno, nuevamente muchísimas gracias por su interés y por compartir con nosotros esta mañana. Como UNICEF, en los últimos 6 meses, desde que entramos en el contexto de la pandemia, hemos estado abogando, como muchas otras organizaciones y muchas otras instituciones, sistemáticamente por la consideración de los servicios de protección como un servicio esencial en el contexto de COVID. Todos sabemos y hemos vivido aquí en la región de América Latina y el Caribe que hemos sido entre las regiones más golpeadas por la pandemia, la región donde se han vivido cuarentenas y alteraciones muy significativas en las realidades de todos los que vivimos en esta región. Y lamentablemente, como vamos a escuchar en el transcurso de esta mañana, los niños, niñas y adolescentes han sido muy golpeados dentro de este contexto. Golpeados en muchos aspectos relacionados con la garantía de sus derechos, incluyendo, y en proporciones muy preocupantes, han sido muy golpeados por las violencias. En esta mañana, en esta horita que tenemos juntos, vamos a conocer 2 análisis que ha desarrollado UNICEF en el nivel global y regional, para ojalá poder entender mejor cómo los sistemas de protección han respondido frente a esta transformación tan grande de contexto que ha ocurrido en el último año, medio año, y también esperamos poder identificar algunas oportunidades y algunos desafíos importantes en este sentido. Esperamos que esta sesión contribuya a fortalecer nuestra apuesta común, a seguir asegurando la protección de todos los niños, niñas, adolescentes contra todo tipo de violencia, a través de sistemas de protección que puedan adaptarse y responder de manera oportuna y adecuada en un contexto muy cambiante y de muchos retos, y en el cual la inversión social en la niñez es realmente inaplazable, pero a la vez sabemos que se ve seriamente amenazada. Escucharemos a las 2 ponentes de UNICEF y luego tendremos una oportunidad para preguntas, ideas y reflexiones de ustedes los participantes. Nuevamente, cualquier pregunta, comentario que quieran compartir en el chat y quieran que sea considerada para la discusión, por favor lo pueden hacer en el transcurso de la sesión y también vamos a dar la oportunidad de abrir los micrófonos al final. Bueno, no me detengo más. Primero, I'm going to switch to English. This presentation is going to be in English. La presentación que sigue va a ser en inglés. Por favor, utilicen si necesitan la interpretación. Si tienen cualquier problema, nos avisa. We're first going to hear from our global advisor, senior advisor on statistics and monitoring, Claudia Cappa is with us. Thank you so much, Claudia, for joining us from New York. Claudia has been working on statistics and monitoring with UNICEF for many years, over 15 years, and she's also been a researcher with ILO, with the University of Geneva, amongst many things. And she's going to share with us a global analysis survey that was done on the functioning of the child protection systems. Thank you, Claudia, for being with us, and we are very happy to hear you.
Thank you so much, Monica, and thank you, everyone. I'm really excited to have the possibility of presenting to you today some statistics related to the risk that children face with respect to violence against children. I'm going to, of course, give an overview of the data for the countries in Latin America and the Caribbean, but I'm going to do so by thinking about also the global perspective as well. As Monica mentioned very clearly, we already know that levels of violence against children remain very high, and this is even prior to the COVID pandemic. Violence is very widespread, particularly certain forms of violence are a common occurrence in the lives of many children across the world. So I'm going to start by giving you an overview of the level of violence against children prior to the COVID-19 pandemic. Starting with the SDG indicator 16.2.1, which is meant to capture the children exposure to violent disciplinary practices at home. So this is an overview of the regional data that we have on the proportion of children below the age of 15 who experience violent discipline in the forms of physical punishment and psychological aggression at home by the parents and other caregivers in the household. And as you can see, the levels remain pretty high. Across the world, more than 50%, more than half of the children in the world experience violent discipline on a regular basis. And in the case of Latin America and the Caribbean, the average for the countries for which we have data from the regions, which are 14 countries, indicates that 2/3 of children already experience violent discipline, again, in the form of corporal punishment or psychological aggression by their parents and other caregiver in the home. So we are already talking about very high level of risks that now the COVID pandemic has accentuated, because we know that from ongoing research and previous literature on children risk during crisis, because of tension, because of aggravation of mental health issues, because of socioeconomic factors, crisis, and particularly COVID-19, are likely to aggravate the main factors, the main determinants that trigger parents to use violent disciplinary practices. So we can expect a further aggravation of this risk, and therefore a possible increase in the severity and frequency of children exposure to violent discipline. Now, going to the next slide, this provides really the country level overview of violent discipline across the countries, 14 countries for which we have data in the region. And you can see there is a spectrum of prevalence levels with countries like Haiti, Jamaica, and Suriname being on the higher spectrum. And in these countries, for instance, according to the data that are produced by national statistical offices through the mixed surveys, we know that over 80% of children below the age of 15 are already experiencing violent disciplinary practices by their caregivers in the home. Now, if we think about the other forms of violence, and we can go to the next slide, we can also think about, of course, children exposure to sexual violence. And this is another SDG indicator, is indicator 16.2.3, that aim at monitoring the proportion of young women and men, 18 and above, who have experienced sexual violence in their childhood, so prior to turning 18. And as you can see, for this indicator, we have, the levels are much lower, because we are talking here about very severe form of sexual violence. We are talking here essentially about rape, and any other form of forced sex. So levels are, of course, much lower, but also the severity of what we are talking about is higher. And we have, again, much more limited data availability, because in the case of LAC, we only have comparable data on this indicator for 8 countries, so it's not representative of the situation in the region. So you can see that Latin America stands now, in comparison to other regions of the world, at 3% of young women and men who report having experienced forced sexual intercourse in their childhood. There are a number of methodological issues related to reporting the occurrence and experience of sexual violence. So underreporting is also expected when it comes to these figures. Now, going to the next slide. This is the specific overview of the countries within the region for which we have data. And in a couple of cases, in the case of Guatemala and Colombia, we have data about sexual abuse also among men. This is, again, even less common in terms of data availability, in terms of availability of findings. Data on men and boys are less common. And again, you have here the countries for which we have data and the levels, and Trinidad and Tobago seems to stand higher in terms of the proportion of respondents. In the case of Trinidad and Tobago is only women who report having experienced forced sexual intercourse and other forced sexual act in their childhood at 25%, so particularly high. What we also know from previous data is that many victims of violence, particularly of sexual violence, rarely seek help. And particularly, it's very uncommon for victims of violence to seek professional help. And this is what we have displayed in the next slide, where in the course of the survey, we ask girls age 15 to 17 who have experienced sexual violence, whether they sought professional help, meaning help from a doctor, medical personnel, police, or social service organization. And as you can see from the data that we have available, which again, unfortunately, is only for 4 countries, a very tiny proportion of victims of sexual violence seek professional help. So we remain at levels of around 10%, 12% in the case of Haiti and Dominican Republic, and even lower for Honduras and Guatemala. So there is still a lot of stigma and barriers to victims that prevent victims from reaching out for professional help, that can be due to, again, on the demand side, in terms of stigma and discomfort in reaching out, but also on the supply side due to the lack of available services that can really meet and facilitate this type of disclosures from victims. So we have a situation of high risk and very limited outreach of the services. And again, both the risk and the inavailability of services is further aggravated in the context of COVID-19. And I want to show you an overview of what is happening to violence prevention and response services in the next slide. So we conducted a survey through our country offices across the world. We ask our country offices to report whether there has been a disruption in 5 violence prevention and response services due to COVID or in the period of COVID. And this is essentially the findings coming out from the surveys. The survey clearly indicate that there has been overall globally severe disruptions in countries when it comes to service related to violence prevention and response. Overall, 2/3 of the countries out of 157 for which we gather this information, 2/3 of the countries across the world have reported a disruption in violence prevention and response services. But if you look at the case of Latin America, Latin America stands actually among the regions in the world with the largest proportion of countries that have reported disruption to violence prevention and response services. So 83% of the countries in the region has reported such level of disruption. And we have also received further information following the closure of the survey. So there is even one more country actually that is not displayed here that has reported this level of disruption. So there are 30 countries in Latin America at the time of the survey and 31 as of now where there is disruption of some sort to child protection and services, particularly when it comes to violence. Now, going to the next slide, I want to give a picture of how many children are therefore deprived of such fundamental services. And these services cover a broad range of back services, including prevention. So we should not think of these services as being only services for children who have already experienced abuse. These are services that are much broader and also target prevention of violence against children. And as you can see in the case of Latin America, we are talking about over 170 million children that are left deprived of the reach of these services because of the disruptions that are due to COVID. So we're talking about 92% of the population of children, of all children living in Latin America and the Caribbean. So a significant, indeed, disruption with millions of children who are unable to benefit from the services. Now, going to the next slide. What are the services we are talking about and which is the most disrupted of such services? So the services that we inquire about cover a wide range of prevention and response outreach, from child helpline, for instance, to case management services, to household visits to children and women at risk of abuse. But also we have programs related to welfare and violence prevention programs in terms of parenting programs, campaign, including campaign related to online safety. And as you can see from this slide, in the case of Latin America, the number one most disrupted service relate to household visits to children and women at risk of abuse. So of course, this is consistent with the containment measures that have been taken across countries that limit, for instance, contact, and therefore the results are not surprising because of course, household visits are very much related to mobility of actors. On the lower end, we see that helpline, child helpline services, hotline, call center services, they are the least disrupted, which of course it's obvious again, because they do not require contact, and therefore this should be something to think about, because as other services are disrupted, child helpline remain operational in most countries. We witness an increase in the number of calls to child helpline. So there is potential for thinking about how this helpline can be strengthened to be able to provide services to children and their families. Now, going to the next two slides, we ask the severity of the disruption. Was the disruption severe in terms of dropping coverage, for instance, that is above 50%? And as you can see, most of the country reported quite severe this disruption in at least one of the 5 services, with a possible estimated drop in coverage of above 50%. And now going to the next and final slide, we ask also the countries that participated in the surveys whether some mitigation measures had been put in place. Mitigation measure to address the disruption or strengthening of the systems more broadly. And as you can see, and this is a positive note, practically 3/4 of the countries had been able to put some sort of mitigation measures in place. These measures have been very different. Of course, in some cases, it go for the delivering of PPE to social worker, for instance. In other cases, was the strengthening of helpline in terms of increasing the number of hours of operation, or for instance, the type of services. But overall, there has been some level of response of the systems and some mitigation measures that have been put in place by different partners at the country level. So I'm going to stop here the presentation, but of course, I will be happy to answer any question you might have later on. Thank you very much.
Muchísimas gracias, Claudia. Realmente una presentación muy interesante, un análisis muy fino. Se escucha muy bien las tasas de violencia tan alarmantes que lamentablemente todos conocemos muy bien, y la preocupación por la interrupción de los servicios de protección, de los sistemas de protección en este contexto, y la comparación con otras regiones. Vemos que lamentablemente, desafortunadamente, somos entre las regiones que más interrupción ha tenido en este sentido, a la vez con esta esperanza y este lado positivo de que han habido bastantes esfuerzos de mitigación y de adaptación de los sistemas al mismo tiempo en la región. Así que muchas gracias, Claudia, nuevamente por tu tiempo y por toda esa información. Ahora vamos a pasar con Kendra Gregson, que es la asesora regional de protección de la infancia para América Latina y el Caribe de UNICEF. También trabaja en la oficina regional de UNICEF en Panamá. Kendra tiene más de 30 años de experiencia en protección de infancia, ha trabajado en casi todas las regiones del mundo: Asia, África, Europa, Norteamérica, Suramérica, Centroamérica. Así que realmente nos trae no solamente el conocimiento de la región, pero también un conocimiento global de temas de protección de infancia. Kendra nos va a presentar, en complemento a lo que ya nos ha presentado Claudia, un análisis más específico y un poco más detallado sobre cómo se están comportando los sistemas de protección de infancia en América Latina y el Caribe, y ella nos contará de dónde viene esta información y cómo la hemos recogido. Adelante, Kendra, muchísimas gracias por tu participación. Nuevamente, colegas, no se olviden, hay interpretación, el botoncito que tienen en el fondo de su pantalla. Kendra va a presentar también en inglés, aunque van a ver que las diapositivas están en español. Adelante, Kendra, y también los alentamos a que vayan poniendo sus preguntas y comentarios en el chat para la discusión que va a seguir después de su presentación. Gracias, Kendra, te escuchamos.
Thank you, Monica, and really thanks to everyone for joining this call. And for your interest and caring about the protection of children in Latin America and the Caribbean. And I really look forward to, one, meeting you eventually and getting to know you, but also in this presentation at the end to your ideas and how we can work better together to be able to better protect children during COVID-19. I'm hoping that someone can share the PowerPoint. Is not appearing on my screen. I don't know if it's appearing on other people's screens. Monica, you're muted.
Kendra, I also don't see it, so I don't know,
Yes.
colleagues.
I'm trying to share my desktop. Just 1 second, please.
Thank you.
If I can also share mine if it doesn't work. We have solutions to these problems.
Actually, I thought that I was sharing my desktop, but I don't see the
Okay.
option now.
So let me try to share my screen. Sorry, apologies, everybody. This will be resolved very quickly.
Okay, now I can share.
Oh, you can.
Yeah, sorry for that.
No worries, Yosu. Thank you so much. Okay, now we're all seeing it.
Okay, thank you. So I'm going to be presenting two different surveys. And the first one, next slide, please. Next slide, please. Was a survey that was socioeconomic survey that was done in homes across Latin America and the Caribbean. And this was a telephone survey that UNICEF organized, and it was carried out in 13 countries in the region. And it was representative at the sample is representative at the regional and the national level. And this survey happened earlier this year between June and August. So there is a period of time, but it was specifically set up to look at what was happening during COVID and what happened to households, but also looking at migrants. Because as we know, migration is an important issue or concern or event, something that's happening quite a lot in Latin America. So we're really trying to follow what was happening with that. And so I'd like to present a few slides on that. Next slide, please. And so if we look, the sectors that were covered in the survey included education, nutrition, health, child protection, water and sanitation, and hygiene, and social inclusion. I'll be focusing much more in this presentation on the economic side of the survey and the findings there. However, I just want to let you know that there are details on the findings for all of these areas, which you can obtain from UNICEF. But I'm just focusing mostly on the poverty side. Next slide, please. And what's interesting about this, or unfortunately reassuring, maybe you could say, is that we're finding some of the same findings that happened from the survey that Claudia talked about also appear in this survey. So there is some consistency. And the main message is a lot of households are now falling into poverty. Households that were in good shape now aren't. You know, if you look at this graph here, normally, and as we said, the sample was representative, normally you would have 20% in each of the quintiles, the wealth quintiles, and that's changed. We don't have 20%. There are, you know, there should have been, we have an increase, 36% of the houses are now in the first quintile and 24 in the second. Next slide, please. And you can see this again here. I'm just focusing on 3 countries. But in Honduras, for example, quintile 4 had 13% of the respondents before COVID would have been in quintile 4. And that means that the proportion of people in the 4th quintile went down from 13 to 10. Alternatively, in quintiles 5 and 3, it had 23% of the respondents would have been in each. And so their fall is even more into poverty. Next slide, please. And so about 50% of homes who were in 3rd and 4th quintiles have fallen to the quintile below. Does that make sense? So they were in, say, the 3rd quintile, and the 3rd quintile, and they fell down to the 4th or to the 2nd. for example. So you can see that here, how we're trying to track how the falls. Next slide, please. And this is exactly showing the same, but what this is pulling out more is that the homes where there are children and adolescents, their fall into poverty was even greater. There was a greater proportion of the homes with children decrease in the level of income that they had. Next slide, please. And we also saw the same with migrants. So there was an increase in the number of migrant populations that became poorer due to COVID. Loss of job was one of the main reasons that they became poorer. And we know that with COVID, and we've seen that in some of our countries, the countries that we're working in, is that with COVID, people are actually might be returning to where they came from, particularly in Venezuela, looking for health care, looking for other coping mechanisms to deal with this fall into poverty. Next slide, please. And it even affects food. So the ability of these families to feed themselves, to feed not only the adults, but also the children, has also changed because of COVID. So the impact of COVID is affecting some of those most basic needs that our families have. And while, you know, this presentation was about, it's about child protection generally, and that specific sector about violence, we know that, you know, these factors of income and food and nutrition, it also affects us as stress. And we'll be coming to that in the next presentation, and how that impacts on the mental health and psychosocial health of the people who are populations of concern. Next slide, please. And so just to share some, you can click two more. Okay, so just to share some principal conclusions from this. The effect of the confinement, the effect of COVID, has been very negative on homes in the region, in that they've fallen more into poverty, and it has affected more those homes, those families which have children and adolescents in them, with a lowering of their overall income. That in turn affects the rights of children, and as you could see also from the right to food. It has there is an increase in the inequality between the rich and the poor in the region. That is growing, it's not shrinking, which is what we always were looking for. And migrants in particular have been affected by that. But all countries are suffering. It's not that some may be more, some may be less, but COVID is affecting all of them. Next slide, please. So let's focus a little bit more on violence. And I think everyone on this call will have examples of violence and have examples of what is happening to children during this violence, during COVID. So in Mexico, we have increased reporting of violence in the home that has begun since the pandemic. In Peru, again, we received more calls into the ministry about violence, and many of them were reported by children, or it's realized by children. In Colombia, we had about violence in the home during quarantine. We hear, and this has been interesting in this region, we hear that children are being put into institutional care during the pandemic because families aren't able to find the food, to have the resources. And so, and I say that's interesting because in other regions, we've had the opposite, where children are going home because the institutions are closing. So there's differences, and we have differences also in this region. I think Chile is a little bit different from Guatemala, for example. But we do have anecdotal evidence that children are being put into Central America and South America. We have migrants on the at the borders looking for with just basic needs, and their ability to be protected has been put in. Next slide, please. So there was a survey that UNICEF did, well, it was a questionnaire that went out to our offices to figure out what was happening with the child protection system due to COVID. Next slide, please. And the next slide, please. And the majority of countries reported that there were interruptions in services due to COVID. And this exactly mirrors what Claudia presented earlier from the global survey as to what was happening in countries with the disruption of services. Next slide, please. And where this disruption is happening, it was 30 countries that were, slide before, please, Yosu. And this effect is 172 million children in 30 countries, and they're affected in many different ways because of the disruption of services, as you can see, and it's 92% of the population of children in Latin America. Next slide, please. Here you can see the services that are offered, and there's a few things I'd like to sort of draw attention to in this slide. One is that we do have some countries that are still able somehow to offer services directly to the family, to see them. However, more are offering virtual, and we see in the region, and we'll share some examples, that the use of virtual connections between the service providers and the families of interest are increasing, and we're learning new tools for virtual virtual communication. One thing I wanted to share with you. The other thing I wanted to share or to point out is the expansion of options for alternative care. So while, I mean, COVID obviously is not a positive thing at all, there have been examples in countries of taking this opportunity to increase reform opportunities, to increase the protection of children, to introduce new ways of working, which we have an advantage or an opportunity now to increase those new ways of working now. And alternative care is one of them. And so we have 10 countries in the region that have really pushed forward that. And we also have that with the judiciary. So ways that, new ways that countries are able to offer those services. Next slide, please. But we have challenges, right? So even though we do have personnel have been able to see children, they don't necessarily have the necessary equipment to be protected themselves. So 18% of the don't have that necessary, of the countries reported that they don't have the necessary equipment to protect themselves when they are visiting countries or their population of concern. There is an increase, as we know, in reports of violence. And there's an increase, as we just noted, on children who need alternative care. Xenophobia continues, and that continues to be a significant challenge in the region, and I'd suggest also a lot of that is also with the migrants. And the restriction in mobility in the region because of the quarantine, or whatever restrictions that the countries have put in place, that directly is impacting on the ability to deliver services. You know, in many countries, the social service has not been recognized as the essential service. It's the health service that's been recognized. And really what we're seeing here with COVID is we're recognizing how essential the social service workforce is for the mental health of people, for their psychosocial support to address that violence. And so those restrictions, you know, so we have the restrictions of mobility, we have the restrictions with the protective equipment. These restrictions are directly impacting on our ability to provide a good service, and in themselves are disrupting the service. Next slide, please. So let's just talk about a few opportunities that we might be able to have, positive opportunities, I said, has come out. Next slide, please. So in Chile, for example, they had in place, and they've learned from before, you know, when in time of emergencies, the protection institutions actually are mandated to mitigate and to provide those services, those basic services, to be able to find a way not to be able to have all these interruptions. And that, it requires that the people are well prepared. It also requires that they have the money in place to be able to do that. In Chile, from an earthquake a decade ago, after that, they put in place sort of a funding pool so that they could draw on it and be able to respond in a case of emergency. And that is what they've been drawing on now during this, this situation. And in Nicaragua, it's been about you know, working to make sure that we have the supplies in place to be able to respond. Next slide, please. As I mentioned, mental health and psychosocial support has become a key issue during COVID. It's actually, you know, MHPSS was rarely on the agenda before, and now it's firmly on the agenda. I think everyone, every family has been touched somehow with that stress, that uncertainty that COVID has brought, that the quarantine has brought, or that those mitigation measures for COVID have put in place, be that because they're not able to leave their home, be that because they're not able to, you know, connect with family, be that because they're not able to work. So everyone has been affected. And so MHPSS is now on the agenda. It's very much on the agenda. And I've put on the slide here some examples of ways that countries have adapted their MHPSS services in order to reach those who are facing difficulty or who may be facing difficulty. So it starts to look at some of the prevention areas as well. And as you can see, much of this is also virtual and developing new virtual forms of communication. Next slide, please. We already talked a little bit about deinstitutionalization and alternative care. As you see, Haiti has opened up a transit center at the border in the town where there's more frequent crossings between Haiti and the Dominican Republic, to be able to make sure that they can continue to offer services. In Uruguay, they have changed some of their protocols so they can guarantee family visits that are safe and can continue. In Guatemala, they've also established virtual contact with families to be able to offer the psychosocial support, and so that can continue despite the COVID. However, just to note, only 10 countries develop new forms of care, of alternative care. And this is something we might want to think about a little bit more, is how can we really, I can say, take advantage of the situation to improve the types of alternative care that we give to children. Next slide, please. And here again, we're talking about adaptations and how we are able to do that case management, right? So case management is normally a person being able to know the case and make the correct referrals and see how that flows back and forth. But that's changed with COVID because people can't go out and visit the same. Some systems are not as active as other systems, or some services aren't there. So how to put that in place? And we have the two examples on the screen, which are from both Mexico and from Argentina. And I also want to note, in Argentina, this is a system that was already there before. So it's really about taking those systems that we have, that part of the structure that we have, and being able to apply it. And how do we adapt it? And I think, next slide, please. One of the things it really shows is our strength of the child protection systems in Latin America and the Caribbean, and how many of them have been able to adapt. And how do we really encourage that can continue to adapt? How can we encourage, and what can we do as agencies to continue to support them? The next couple of slides are some suggested recommendations that we might want to think about. The protective equipment that is necessary and there's different levels of protective equipment, as we know, but what is needed for who, when, to make sure that our essential social service workforce can do their work. What can we do to better prevent the separation of families and children? And we think that particularly when you're talking about quarantine or hospitals. So what we do to make sure that families aren't unintentionally separated during this time. We know that other sectors sometimes have more of the essential service workforce than the child protection sector. And so how can we encourage our intersectoral work, and how can we strengthen them? We've talked about the adaptation of case management and about we need to make sure that the social service workforce is considered an essential workforce. That while, yes, we need to use virtual services, but you still need the social service workforce there to be able to do those virtual services. So how do we strengthen some of those and yet maintain some of the home visits? Next slide, please. Migrants need to be able to access the system. So wherever anyone can touch this system, and some of those places that people went to before aren't there now, or they've changed, or they've moved. And so we need to be able to communicate where they are, make sure that there are services there that fill in those gaps. We have to look at what's happening with the schools. So schools have closed. In some areas, schools are reopening. What does that mean for the protection of children? Family contact, which we discussed, as well as adequate health and education. Next slide, please. I just want to leave this slide on there just for a minute for you to read through some of the questions that you might want to consider. And we pose them because while after this, next we will open up the floor to discussion, I hope we can not only talk about questions for us, for Claudia and I, but really start to talk amongst ourselves about some of the solutions. And what else do we need to do, or what more support can we provide, or what sort of areas do we need to consider, because there's also unintentional consequences that come out because of there's potential unintended consequences as well from any actions that we do. So what do we need to put in place to better respond to COVID-19? And next slide, and thank you very much. And back to Monica.
Thank you so much, Kendra. Thank you for that presentation, and especially for... voy a hablar en español para que puedan tener una variedad. Muchas gracias, Kendra. Gracias por esa presentación, y creo que sobre todo por marcar el contexto de protección y de los sistemas de protección dentro de una dinámica socioeconómica muy compleja y muy cambiante. Y ahí veo que varias de las preguntas y los comentarios que se están haciendo en el chat van en esa línea. Si quieren, voy a aprovechar y leer algunas de las preguntas y comentarios en el chat, darle la oportunidad a Claudia y a Kendra de responder, y a la vez, colegas, por favor, el que quiera intervenir también tiene la posibilidad. Lo que necesitamos es que pongan su nombre en el chat y ahí luego les abrimos el micrófono. Kendra and Claudia, some of the questions coming out of the chat are around disaggregation of the information by age, sex, gender, country. If you can speak to that with the different surveys that you've presented. And the second group of questions or reflections that are coming out are around the context of the economy. And particularly, one of the participants says that the poverty is increasing, and at the same time, that makes it harder for people to be able to access all these virtual mechanisms for protection that are coming out. So to be able to pay for minutes on internet, for cellular phones. So for the most poor and those falling further into poverty, how can we ensure that they can access these virtual mechanisms of support? I think those are two of the questions in the chat. And also, if you can speak, Claudia, maybe a little bit to what has allowed other regions to have less interruption in service than Latin America and the Caribbean in comparison. What are some of the factors that have helped other regions to be able to continue services? So maybe, Claudia, I'll start with you. If you can speak to those questions and comments, and then to Kendra, and then we'll do another round.
Thank you very much, Monica, and thank you about disaggregation of data, because that's a very important point. We know that not all children face the same risks. There are important variation in terms of sex, in terms of level of wealth of the family, etc. Now, the prevalence data that I display at the beginning of my presentation on the levels of violent discipline, for instance, or sexual abuse, these are coming from household surveys, like mixed. So we have data available by sex of the child, for instance, of violent discipline, age of the child. We have level of education of the parents or socioeconomic background, but we do not have data from those results that we can be disaggregated by migration status. That's not, unfortunately, available. But other common socio-demographic characteristics of the child and the family, yes, this is available from the data set and will need to be recalculated, but is available. Now, the question about what has happened in the region versus other regions when it comes to disruption in services, it goes beyond my level of competence and expertise. So I would like to pass the floor to Kendra, but if I might, just from a purely statistical and evidence standpoint, clearly the variable of the spread of the virus and the measures that have been taken by the governments to contain the spread of the virus have an impact. So other regions, for instance, like Kipro, so East Asia and the Pacific, many countries in that region, for instance, particularly 14 countries in that region that are from the Pacific areas, they have not been affected as much from the virus. There have not been containment measures And this can help also explain why the severity of the findings for Latin America. So in many cases, the spread of the virus was associated with a different level of severity of confinement measure, although there is not a linear association. And this can be also behind this significant level of disruption that we see in the region. But I'm going to hand over the floor to Kendra, who has a much broader experience and expertise in this area.
Thank you, Claudia. In terms of disaggregation, from the survey that was conducted by LACRO, when we're interviewing our individual country off, that is by country only in terms of that disruption. So, for example, in that survey, Montserrat reported that they didn't have a disruption of service. That was the only one. Cuba as another one, moderately disrupted. And then others were more severely disrupted. So on that one, for the survey, we have some disaggregation. In terms of the household survey, there is some, and I agree with you. We need to look at that a little bit closer to see how much further we can disaggregate. In terms of your question of poverty, and people are poor, and so some of the virtual services they can't access. I agree with you completely. I mean, we need to think of more creative solutions. I think the example from the Caribbean is quite interesting, because that helpline now is completely free of charge, so that people can call in regardless. But then again, they need a phone, right? Once they call, they can get in, but they need a phone. And I agree. I mean, I think we have to continue to brainstorm together, and we need all of us together on this, is what we can do better to be able for those because when poverty can affect the ability to access the service. So I agree, we need to work together. The other thing I think we need to do, and I think Latin America has some fairly strong systems, is that when a person touches that special child protection system, wherever they touch that system, whether they touch it because they've gone to the hospital, or they've seen a police officer, or they've visited an NGO, wherever they've touched that.
ONG, donde quiera que se toca el sistema, se refieren rápidamente a servicios abiertos y
management may or may not have been adapted, but if there's any way when they touch that it can automatically be referred on, and that highlights that intersectoral, the need for the intersectoral work that I mentioned. If I can give a couple of examples from other regions, and just to share, in Pakistan, for example, the social service workforce is not considered essential, and they're basically at home. The service is closed, and yet people need some of the services. And so the ministry and UNICEF supported it, connected with the health sector. And so the health sector has now brought in the social service workforce into the health sector, so that because the health sector is essential. So it's really a change of paper more than anything else, but brought them in so that that essential social service workforce can continue to offer MHP, mental health psychosocial support services. So that intersectorality has had a whole different level of importance now because of COVID. And I shared that because I thought it was quite a clear example of, of a complete lockdown in one group, one profession, and using the other sector to be able to help. And I haven't seen as clear a division in Latin America, but I'm sure there are in some cases, some things. So how do we make that intersectorality go better? Yeah. Back to you, Monica.
Muchas gracias, Kendra y Claudia, por las respuestas a las preguntas. Solamente avisar que parece haber un problema con la traducción. Estamos recibiendo algunos comentarios sobre el volumen de la traducción. Si a mí se me escucha bajito, definitivamente no es mi voz.
If I have a
quizás demasiado fuerte, así que si pueden, por favor, revisar la traducción. Hay varias preguntas en el chat sobre diferentes sectores de protección, temas de niños en contextos de privación de libertad, en conflicto con la ley, niñez migrante y la inclusión de algunos países u otros en la encuesta. Siguiendo esta conferencia vamos a pasarles las infografías y la información que tenemos ya organizada sobre estos diferentes sectores y el nivel de interrupción, y también los países que han participado. Como decía Kendra, son 23 países que han participado en la encuesta de LACRO. Lamentablemente no hemos podido destacar todas las buenas prácticas y todo lo que se está haciendo en los países en esta presentación, pero sí nos gustaría seguir esta conversación y diálogo y poder tener más foros donde se puedan compartir posibles soluciones y oportunidades. Voy a pasar el micrófono a Rodolfo Mendoza. ¿Cómo estás, Rodolfo? Un gusto saludarte y te escuchamos. Interesante poder escuchar a alguien del público.
Muy buenos días. Muchísimas gracias. Encantado de saludarlas y felicito las excelentes presentaciones. Yo vengo trabajando en América Latina el tema de inversión en la infancia y hay una pregunta justamente sobre oportunidades. Y creo que es el momento, desde nuestro punto de vista y escuchado en varios foros y también en instituciones como CEPAL, ¿no?, plantear algunos cambios en las políticas macroeconómicas, específicamente en las políticas fiscales. El problema de los sistemas de protección integral se empiezan a visualizar con la pandemia, pero ya los problemas tenían ya antecedentes y venían afectando a la población de hace muchos años. Entonces, esto realmente es una oportunidad. Pienso que esta situación dura, difícil, porque se han señalado datos de la encuesta, pero ayer estuve en una reunión parecida donde los problemas son terribles. Lo que viene pasando, por ejemplo, con el embarazo adolescente, producto de la violencia sexual que viene ocurriendo en los domicilios. Y es más, hay embarazo, se está incrementando embarazo a menores de 14 años, de entre 10 y 14 años, y una serie de desatenciones de salud sexual, ¿no?, disrupción de los servicios, como se ha señalado. Entonces, yo lo que quería proponer, ¿no?, en esta situación tan difícil y a la vez oportunidad para cambios, es que los estados tienen que asumir cambios en la política fiscal. En América Latina, ya todos sabemos, es el continente más desigual. O sea, hay pocos que tienen mucho y muchos que tienen muy poco. Entonces, el problema es buscar un poco de equilibrio para romper esta desigualdad, aunque sea de a poco. Y esos cambios en la política fiscal sugieren cambios en la tributación, sugieren cambios en eliminar exoneraciones que no tienen razón de ser, sugieren cambios en que el Estado sea más activo, más proactivo, más eficiente, más eficaz en captar los recursos que no captan, en evitar la elusión, la evasión, en fortalecer sus sistemas de financiamiento. Solamente eso, no quiero expandirme más, pero creo que es una oportunidad para cambios en la política fiscal, tributaria, de gasto público, mejorar las asignaciones en los presupuestos públicos, visibilizar a los niños en los presupuestos públicos y paralelamente manejar el tema de la deuda. Muy agradecido por la oportunidad. Este es un tema que da para más, pero bueno, habrán otras intervenciones. Gracias, Mónica, encantado de saludarte y gracias a las expositoras.
Muchas gracias, Rodolfo, y gracias por siempre poner los temas de inversión en infancia en el centro de la discusión. Kendra también tenía una pregunta ahí en su diapositiva sobre cómo aseguramos que realmente se priorice la protección de la niñez, la inversión que necesitan los sistemas de protección en este contexto de COVID. Ahí devolvemos la pregunta que tú has hecho a las panelistas sobre el tema de inversión en protección en este contexto tan complejo. Y quizás agregar, antes de volver también a las panelistas, otra pregunta que veo en el chat sobre niñez en situación de calle. También tenemos preguntas sobre niños migrantes, niños en contextos de alta vulnerabilidad, y cómo podemos poder registrar estos casos, llegar a estos casos en este contexto. Kendra, quizás empezando por ti en esta ocasión, en esta ronda, las preguntas sobre inversión, algunas reflexiones cómo asegurar la inversión en infancia, y bueno, Rodolfo hablaba de la reforma de los sistemas fiscales en este contexto, y también la parte de los niños más vulnerables en situación de calle, fronteras, etcétera.
Thank you. I'm not sure how I'm going to answer the questions. You know, except to say I agree. I thought the example from Chile was really important because it highlighted how they took forward a learning from 10 years ago and are applying it now. So by having that sort of, I'm going to call it a slush fund, it's not a slush fund, but by having a way that they could draw down on the funds. The other thing I thought it showed was it illustrated concretely that, you know, the government realized that during crisis like this, mandates, even though you still have the same mandate, things are shifting. The priority of the mandate or the weight of different parts of the mandate change. And because of that change, your budget changes. And so, you know, I think there's a realization of that. So I thought that was a good example and something that maybe might be appropriate with other countries now that they've experienced COVID about what they could do. In terms of taxation, you know, it's going to be, I think, an interesting 2 or 3 years as to what's going to be happening with the tax system. We know in high-income countries that they're already predicting a reduction in the income or the funds that they will receive from taxation because of COVID. And countries are already adjusting their budgets. And I see that in high-income countries. It's something we need to watch in the countries in Latin America and the Caribbean to see what that change is going to mean, and how, you know, we know that budgets are normally prepared a year in advance, basically, or the budget process. But what's happening right now, you know, for next year, and where we can, what can we do to influence to make sure that protection continues? We know there's going to have to be adjustments. I mean, we can't always ask for more, because there's limited funding. So I don't really know what else to say about that. It's something we have to really look at the advocacy and watch, and maybe think of you know, other mechanisms such as what's happened with like with Chile, and also potentially, and this is also difficult, is what are the priorities during pandemics? Is there a way to think about what is that priority that we have to do? You know, if you look at the medical system, it's very clear, you know, they had to have certain equipment to be able to deliver, like their PPE or their ventilators or whatever. So I'm not a medical person, so if someone's medical, they probably know much better than I do. But, you know, what has to happen? And is that something that we need to think about for child protection as well? What are those things that have to happen during an emergency? In UNICEF and in the global community, we do have our core commitments to children and our sphere guidelines. And I wonder, is that something that we need to look at a little bit more, reflecting on what's happened during this pandemic? And that, I think, would also help us in terms of that budgeting situation. In terms of migrant children, I mean, you saw the one slide which showed that the poverty has increased for children who are migrating. And I also mentioned that we see in some places, particularly Venezuela, a change in direction, with some children returning and families returning to Venezuela because they've lost their job or their income wherever they are. And there's been some returns, particularly thinking about the healthcare system that they could get. And that's quite difficult because, I mean, the entry into Venezuela is also slow. We also see in some countries, and I'm now going to be thinking globally in high and low income countries where the state has, or NGOs have set up different types of shelters for children who are on the street or people who are on the street, because the current shelters where they might be or the areas that they might access are too crowded. And so there has been some move to open up other sorts of shelters or programs because they're too crowded. That's good. It's done with a health perspective. But as we talked about before, in terms of the finance and the investment, there's also a question about, how do we maintain that quality? How do we maintain, governments, organizations already have difficulty maintaining those inspections to make sure everything has a standard of care. If you have a plethora of services, what does that mean for that inspection? And what does that mean for the change for after the pandemic? Because I think we have to think about what we're doing now to also think about what happens after. We know, for example, in the emergency, we don't build institutions or alternative care, residential care, because it's hard to close them after. So we have to be really careful or think ahead is what are the potential unintended consequences of our programming so that we can put those mitigating factors in at the beginning. I'm not sure if I answered your question, but sort of sharing some thoughts for the conversation. Back to you, Monica.
Thank you, Kendra. La verdad que todas reflexiones muy pertinentes y importantes de mirar cómo las decisiones y las estrategias que implementamos pueden tener ciertas repercusiones. Nos quedan pocos minutos. Quiero devolverle la palabra a Claudia para que también pueda dar algunas palabras de reflexión sobre los temas que se han puesto aquí en la discusión. Tenemos, Claudia, además algunas preguntas sobre la protección de niños en línea. Sabemos que una de las violencias que parece haber incrementado o que ha incrementado en este contexto es la violencia, la desprotección de los niños en línea y que los niños y las niñas están cada vez más en línea en este contexto COVID. Y también hay algunas preguntas sobre cómo se articula las preocupaciones, los servicios de protección con la reapertura de escuelas y la reintegración en escuelas. Claudia, te paso la palabra para tus reflexiones finales. Muchas gracias.
Thank you, Monica. Let me start with this point about online violence. Because as we think about many children having to transition to online learning, but also we know that children are using online platform for socialization, for exchanging with their peers, for playing with their peers. So it's beyond learning in a way. There is this overwhelming concern about violence online and exposure of children to abusive language, abusive content online. And we have recently completed an analysis of Twitter and Reddit, social media platforms for 16 countries in the world. Some of them are, of course, also Latin American countries. And as there has been indeed an overall increase in the use of social media platforms, the increase in abusive content, in abusive related testimonials has increased even in more significantly, meaning that not only children are indeed more online, but as they are more online, they experience more online violence in the form of cyberbullying, but they also use online platforms to talk about violence. So what does this mean programmatically? It means that platforms have to be held responsible for really ensuring the protection of children online. So there are certain policies in place, but clearly there are also continued and increased risks. And this type of platform have to be held accountable. Parents have, of course, to be alert about the risks. But what is also coming out is that these fora, online fora, are now vehicle through which victims of abuse talk about their victimization. So as other services are disrupted, is there an entry point for using social media platform and identifying victims, reaching out to victims, providing services? It's a complicated field of work with a number of different complications and constraints, including from the ethical and privacy standpoint. But is there an opportunity also there that we need to think about for providing services to victims and also for identifying victims, etc. The second reflection I wanted to bring up is very much about data. And I'm sorry to be focusing on data, that's my field in a way. Many countries still have weak administrative records. They're not functioning well, particularly when it comes to violence against children. So we already have a hard time understanding the ability of services to respond to victims. And therefore, this COVID-19 and the crisis has also emphasized the need to have very strong administrative data systems, because they are the first sentinel type of elements or indicator that we can use to monitor drops in coverage of services. But if the underlying data are weak, if the data are not, they don't have a proper flow, they're not analyzed, then you have issues in being able to understand exactly what's happening to children when it comes to the ability of the system to respond. And that's what administrative data are for. They're really not statistical evidence per se. They're really an indication of how the systems are working. So as we think about strengthening the service related to violence against children, we also have to remember the importance of strengthening the collection of data from these services, because that's fundamental as part of the response. And the last thing I want to mention is, as a researcher, I've been thinking about this issue of increasing violence. What do we expect this type of increasing violence to be? Are we expecting non-violent families all of a sudden to become violent? So are we expecting an increase in prevalence of violence, or do we expect an increase in severity and frequency of violence? And my instinct and what I've been trying to research on is very much around this difference. And I'm afraid the biggest problem is about increase in severity and frequency, meaning those children who are already victims of violence, they are being victimized more severely, more frequently. So we are already talking about very vulnerable populations. We are not talking about new cases as much. We are talking much more about a severity that is becoming really beyond what the normal conditions is. So what do we do for these children? Because they're already vulnerable to begin with. So is there a different strategy for them? How do we identify them? Because most likely they're also those who are deprived of access to many other type of services. Just a couple of reflections to conclude my intervention. And thank you very much. I found the conversation extremely interesting and stimulating.
Claudia, thank you so much. We really, truly appreciate your participation, the global perspective. And I think this last reflection from a data and analysis perspective of how the severity is really something that we have to be concerned about. Perhaps not so many new forms of violence, but really how things are being aggravated in this context, and what the proper response is, the adequate response is. Thank you. We really appreciate your interventions. Kendra, I'm going to give you the opportunity in case you have any last words you'd like to share, any closing reflections or remarks. And if not, we're going to have to conclude because we're losing our translation very soon.
Thank you very much, Monica. And really nothing more to add except for thank you to all of the participants for joining this call. And I hope that we can continue this conversation and continue to work together and join a partnership to better protect children during COVID. Thank you.
Muchísimas gracias, Kendra, por tu participación desde Canadá. Kendra todavía está intentando llegar a la región en este contexto COVID con todas sus afectaciones. Gracias por todas las reflexiones. Y bueno, quizás concluyendo solo con la reflexión de que estamos en un contexto muy cambiante, estamos en un contexto nuevo, no sabemos qué va a pasar en los próximos meses en el mundo, en la región, con la pandemia y con todas sus implicaciones. Va a ser importante seguir monitoreando y midiendo cómo están funcionando los sistemas de protección en la región en este contexto. Va a ser importante seguir entendiendo cuáles son esas medidas de mitigación que están funcionando, esas adaptaciones que estamos viendo a lo largo de la región, en los diferentes países, que podamos seguir compartiendo las buenas prácticas. Y como decía Kendra, tenemos que seguir este diálogo y también seguir trabajando juntos en estrategias para asegurar que los servicios de protección puedan seguir siendo servicios esenciales, que lo son, y que puedan funcionar adecuadamente y oportunamente para proteger a todos los niños, niñas y adolescentes de la región. Por último, una cuña. Tenemos varios documentos que pueden responder algunas de las preguntas que han sido puestas en el chat. Tenemos algunos lineamientos que hemos desarrollado en el contexto COVID para la protección en línea, para la protección en general, para niñez migrante, para la reinserción y reintegración a la escuela. Así que les invitamos a visitar nuestras páginas web y conocer esos materiales. Colegas, amigos, amigas, muchísimas gracias por estar con nosotros esta mañana, y qué bueno que seamos tantos con esta preocupación de seguir protegiendo plenamente los derechos de la infancia y adolescencia aquí en la región. Se les agradece a todos, y se les agradece especialmente a las oficinas del país de UNICEF, quienes han sido los que nos han dado toda la información, o mucha de la información que hemos compartido con ustedes. Es información que viene desde lo local, desde lo nacional, y ha tenido una integración regional y global, pero realmente agradeciendo ese trabajo que se hace en terreno. Abrazos, cuídense mucho, estamos a la orden. Vamos a compartir las presentaciones y los otros materiales que también les hemos mencionado. Muchas gracias, Claudia, gracias, Kendra, gracias a los intérpretes y gracias, colegas de la región.